union was founded in 1920 by a set of organizations, primarily ministries of health, who were passionate about ending the tuberculosis epidemic. I don't know of any other organization that puts all the pieces together in public health like the union does, with advancing science as well as taking that all the way down to how programs work on the ground for people. The union acts on its knowledge, brings people together to implement change, and by that ability becomes a leader in public health.
The union is always focused in three areas of work: know, share, act. Each of those in their own way is essential to conducting the work we do. Some of the prime examples of know is in the union's direct implementation of research.
What operational research is all about is the search for knowledge on strategies, interventions, tools which can improve program performance and healthcare delivery.
The continuum goes all the way down to clinical trials. In the STREAM clinical trial, it is an excellent example where the union is the sponsor of a trial that really has the potential to change policy and programs in a meaningful way.
Турж хичээл тэгэл айгу яатруу байсан л та. Тэгээ одоо гоё байна. Гоё олж байгаа. Одоо тэгээд одоо үнэн магашгүй ер нь бол гарах гэж байгаа.
STREAM is a clinical trial which is testing a shortened treatment regimen for MDR-TB, multi-drug resistant tuberculosis, against the current standard of care. So the 9-month regimen we're currently testing in STREAM Stage 1 is a huge step forward compared to the current regimen. 24 months of treatment compared to 9 months is a marked difference and makes a huge impact on patients' lives.
Инсулинтэй өвчтнүүдийг эмчилгээний одоо энэ богино хугацаатай болгох тий одоо түүх болон одоо үлднэ гэж бодож байна. Эмээ уухтай нөхцөлийг бүрдүүлж одоо сайн дурын идэвхтнэр эмийн гэртэнд хөргүүлж өгөх бас боломжийг олгож өгч байна. Мөн бодвол
тэгэд одоо ингээ над дээр өдөр болгоо ингээл ирээл миний эмийг харж уулгаал. Тий. Тэгэхээр бас айгу сайн. Тэгэд 2 жилийн хугацаанд ингээ ярихаар хүмүүс нэг л ингээл урваагаал одоо яаж дахиад ингээ 2 жил ингээ үргэлжлүүлж уунаа гэд айгу ер нь хэцүү идэв. Эмнэлэгтээс хүмүүс ер нь тийм байсан. Намайг байх хугацаанд хүмүүс тийм байсан. Тэгээ би болохоор хажууд нь тэгэл 9 сар штэ гэл ингээл айгу оохот айгу сэтгэл санаач айгу гоё идэгс аахгүй. Тэгэхээр энэ айгу хэрэгтэй.
We believe that the patients in Mongolia will be in better hands as a result of the experience of the health system in the program in participating in this trial.
Тэгээд тэрүүгээрээ жоохон юу байгаа. Айгу өдрөг хяналт стримд орсон доо жоохон баярлж байгаа.
Ultimately, it's about the patients in affected communities. We have an obligation to work towards a shorter, more tolerable treatment regimen so that someday a diagnosis of MDR-TB won't be the catastrophic diagnosis that it is today. And it's only research that's going to get us there.
It's one thing to be an implementer, but to share this information is what's important. It comes at very different levels. You can have an individual learning at a course that we give. We also have our international conference every year. It's really a place where thousands of people can share what we know about the field. We also hold a conference on tobacco, where the people that are important in tobacco control get together. At another level, there's the whole communication piece that we're able to do. Part of that is working and sharing with partners, so they're able to do their own work. For example, in tobacco control, we teach partners how to work with their governments in order to advance the cause of tobacco control.
The union provides both resources and technical assistance to organizations like mine. So with support from the union, we in turn have been able to provide aid to the government in developing tobacco control policies and legislation. With a grant from the union, we funded a study by the University of Cape Town, which predicted what would happen if tobacco taxation did not increase or if it did increase, and what the impact on public health would be.
In working for an organization like the Union, I have the contact with people really in country to see what the situation is on the ground.
We have decided as South Africa to look at which people in the population, which key groups are most vulnerable. Number one are inmates in correctional service facilities.
Today we went to Pollsmoor Prison in Cape Town, South Africa. What the Union did was bring media to really highlight that prisons are a place where there is an increased rate of tuberculosis compared to the general population.
We launched a program for screening and intensive management of TB. Every inmate, every person who enters the prisons must be screened. That never used to happen in the past. Those who are incarcerated must be screened twice during their period of incarceration.
I was coughing for 4 weeks, but I didn't go to the clinic. I was outside. So when I come here, they found me. They say I've got a TB. So after that, they say, oh, they're going to take me for the treatment for 6 months. I was losing weight. I was coughing.
I think that's the story, that there's access to healthcare anywhere and that access to healthcare is needed everywhere. So I think for me what was important about the visit today and what was important to cover the story is to understand the lives of the inmates. How are they affected by TB? To what extent are they getting treatment? And most importantly, how do they feel about that?
I'm feeling better now. I'm feeling healthy because I'm finished my treatment this month.
The reason why the Union did this media tour is to really shine a light on the particular issue. It's not just an issue for South Africa, it's an issue all around the world. Anywhere you go, a prison, a jail is a place where you're going to find tuberculosis if you're lucky.
To me, it's really interesting that the Union does have this ability to act at a very high level and bring the people of power together, but yet at the same time still has the compassion and ability to bring care to the individual patient who needs it. ACT also is to advocate and advertise the advances in public health, especially in tuberculosis, and motivating that political will that's going to give us the resources that we need.
Stand up and call on the people who represent you to act. Stand up and say 200 years is too long. We can beat TB in a generation, and we must.
It's the implementation of programs, of taking the science and seeing how they translate into the real world.
By the year 2030, low and middle income countries will account for 3 out of 4 people who die from tobacco-related illness. We must end the practice by which governments themselves are the tobacco industry. Looking across this room at all of you gathered here today, I know that we will prevail.
What is knowledge if you don't use it? We've actually gone to the ground and shown, I think, the world how to try to get some of these things done.
The TB epidemic in the country is largely driven by HIV, where we are looking at 70% of TB patients being co-infected with HIV, which really becomes a priority area of focus.
The Union came up with the idea for the integration of TB and HIV. This integrated TB-HIV care has worked, and now this has been adopted by the Ministry of Health as good practice.
A patient doesn't have to access services at different service points. Everything would be under one roof.
My name is Constance Manwa. I've been treated for MDR TB when I was pregnant with my firstborn baby. That's when I was tested for HIV. I tested positive.
The Union provided mentorship. They provided the medicines in the earlier years, and they provided the support to ensure that the program went by.
Everyone was trained here by the Union. Every nurse is taught everything about HIV patients, about TB patients.
Just went so well, and I started gaining weight, started gaining strength, started gaining confidence, started feeling alive again.
We have demonstrated that indeed we can provide integrated and decentralized TB/HIV services within resource-limited settings.
This country is one of the success stories of managing HIV properly. As we begin to control HIV, TB prevalence is also now beginning to come down.
I was successfully cured. My son is bouncing, he's 6 years old now. We are happy. Being HIV positive is not the end of the world. You can still do wonders. You can still do wonders as long as you accept your status and move on, and you learn to live positively. You learn to live positively.